Eye bags or hollowness. My eye bags and hollowness started about 7 weeks ago. I am 29 years old. Get adequate sleep. I have sinus pressure, but nothing will help this area. Does this look like bags or hollowness? Eye creams are not helping, and I can't take a decongestant due to breastfeeding. Do I need surgical help here?
Thank you for your question. You submitted your question with a photo, and you're asking about the appearance of what you recognize as possibly under eye bags or hollowness, which is the basis of your question, and that you've been having this at the age of 29 for only the past 7 weeks. And you go on to describe some of your situations with your sinuses, but currently you cannot take a decongestant because you are breastfeeding. So I can certainly share with you my perspective for a situation like yours, which comes into my office pretty constantly every day. Not so much in exactly the same way, but basically the question is whether a person has under eye bags versus hollows. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with the appearance around their eyes, whether it's with under eye bags, whether it's with hollows, and as well as upper eyelid surgery and wrinkles, etc., is a core specialty in my practice. And as I said, I've been doing this now for over 20 years. So to begin with, I think it's important to recognize first what is the issue and how it is being expressed currently. When you submitted the photo, you actually were looking upwards, and that's actually very helpful. When you look upwards and this bulge appears, well, that is pretty consistent with something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eye pushes forward and creates this bulge. Now, patients often, and just people in general, not just patients, but people often look at themselves and see this bulge, but rather than focusing on the bulge, they look at the area adjacent, the area below it. And that area is perceived as the under eye hollow. Now, that being said, when you are noticing something like this for only 7 weeks, certainly I have observed over the years that for some people, fluctuations in allergies and sinus issues can cause these bulges to look more prominent. And when people have this type of situation, I basically ask them, is it constant? Is it where it doesn't matter how much sleep you get or whether you're already managing sinus problems, allergies, etc.? Is it still fairly constant? And a lot of times patients will say that there are days that they look good and there are days they don't look so good. So I say that essentially you do something when there are more not so good days as there are good days. And when you have a modest amount of fat prolapse, although surgery is probably going to be the ultimate definitive procedure, in our practice we have certainly embraced a strategy, especially for busy people, to also use ways to camouflage this fat prolapse. And again, this is fat that is pushed forward, and essentially it's a hernia, and that's why it's referred to as herniated fat. But up to a certain level, you can actually place a filler, and a filler such as in the hyaluronic acid family, such as Restylane or Juvederm, and you place it in this area right below the fat that's called the tear trough. Now, this procedure is done with a little bit of local anesthetic and is done with technique so that there's a minimum chance of bruising. And basically, within a few minutes, you can actually blend the space between the bone and the fat. And that helps to make this area look a lot better, and patients who are having this just as a minimal problem are very pleased and very satisfied with this strategy. If the fat becomes more prominent to the point where you can't blend it so well, well, that's probably a good time to consider surgery. A lot of times people don't want to spend the time and the cost of doing injectable fillers, and they'll just want to go for the surgery from the beginning. So it's a matter of personal choice and lifestyle, etc. I think you can maybe allow yourself a little bit more time, since it's now been only 7 weeks, to establish whether this is being constant for months rather than a few weeks. And if such is the case, and you mentioned that you're breastfeeding, so depending on how far along you are away from the time you delivered, hormonal levels and fluid can also have some degree of impact. And it's just a matter of observation. So before you move forward with any procedure, you can meet with an experienced, qualified specialist and discuss these variables and see what transpires in terms of a physical examination. And when you look from the perspective of not only the front view with your eyes looking up, but as I do in my practice, I take a lot of pictures, and then I review these pictures with my patients, and I'll take a front view, a 3/4 view, a side view, and of course a physical examination to get a sense of volume and what would be a strategy that is optimal for the individual patient. So again, meet with experienced, qualified specialists, make some observations on your own as to how this is appearing, and if it's constant, then again the strategy can be filler or instead of surgery for a while, or just surgery, but it doesn't negate the possibility of still needing filler if that area still looks a little bit hollow. But that's a conversation to discuss with your doctor. So I hope that was helpful. I wish you the best of luck. Thank you for your question.